Sir, what is the basic difference between cosmetologist and a dermatologist? Sir, when these fake academies like ILMD, they are all banned, but still they are selling their PG diplomas and running ads openly. So who all are protecting them?
See, glutathione, it is available in the oral route
Okay.
and IV route. And oral route is safer. IV route is having all these unsafe conditions.
सर एक मेरा ये भी सवाल है कि जितने भी हमारे ट्रेन डॉक्टर्स हैं उन सबको तो आजकल इलीगल बताया जा रहा है, जबकि जो पार्लर्स हैं दे आर गिविंग इंजेक्टेबल्स बट स्टिल दे आर लीगल. सो हाउ कम?
They don't want to blame the saloon and other people because through that sources they may get the patients. Because ultimately the saloon people, the cosmetic chain, they cannot get into too much into the procedures. They can do basic works.
सर जो भी इंजेक्टेबल्स हम लेते हैं हेड एंड नेक में, तो हु इज़ द बेस्ट प्रोफेशनल्स टू गो विद? वो एक डर्मेटोलॉजिस्ट होना चाहिए, कॉस्मेटोलॉजिस्ट होना चाहिए, ऑप्थेल्मोलॉजिस्ट होना चाहिए, या कौन होना चाहिए? बेस्ट प्रोफेशनल कौन रहेगा? हमें किसके पास जाना चाहिए फॉर इंजेक्टेबल्स? आज का ये जो पॉडकास्ट है आप सभी लोगों के लिए बहुत ज़्यादा हेल्पफुल होने वाला है. कैसे? क्योंकि देखिए लोगों को प्रॉब्लम पता है कि उनके साथ क्या प्रॉब्लम है, बट उसका सोल्यूशन कहाँ पे है, एग्जैक्ट सोल्यूशन उन्हें कहाँ मिलेगा? जस्ट लाइक कॉस्मेटिक सर्जरी कह लीजिए आप, या फिर कॉस्मेटिक प्रॉब्लम्स कह लीजिए, फिलर्स कह लीजिए, बोटॉक्स कह लीजिए, लोगों को पता ही कहाँ है, बट उन्हें ये नहीं पता कि एग्जैक्टली जाना कहाँ पर है उन्हें. तो इसी चीज़ के ऊपर हम, इसी बेसिक प्रॉब्लम के ऊपर आज हम बात करेंगे आप सभी लोगों के साथ, और आपके सभी सवालों के जवाब हम आज देंगे. तो आपके सभी सवालों के जवाब के लिए आज हमारे साथ जुड़े हैं डॉक्टर VK स्वामी सर. सो ओवर टू यू सर.
नमस्कार. आपने सही बोला है. कॉस्मेटिक सर्जरी तो you can easily find out the cosmetic surgeons.
Right.
After MBBS, MS, they have MCH, the specialization for cosmetic surgery. But everyone not interested in surgery as such. They like to get some kind of corrections through non-invasive procedures.
Right.
Or some injectables, like as you rightly told, Botox, fillers, peels, lasers, PRP, PRF, all these things are very much flourishing in the market now. But public is misinformed. I can cautiously use the word misinformed because of the interested groups. They want to promote themselves, their own groups, their own associates, and they take the help of even the regulatory authorities. You would be shocking to know the state medical councils, which are supposed to keep just the registry of the registered medical practitioners and to monitor them. They are now jumping into regulatory overreach. Means they want to dictate who will do what, and they want to prevent particular group of practitioners also. If you ask me, if you define medical practice, medical practitioner, any stream, they are called to be registered medical practitioners, registered with any council, particularly these regulatory councils. But there is a confusion. We will look into it. We will discuss point by point where we have to be cautious. Instead of advising the public where to get the treatment or where to undergo the procedures, at the same time where to not to get that procedures done by which doctor, which surgeon we should avoid.
Sir, what is the basic difference between cosmetologist and a dermatologist?
See, dermatologist need not be the cosmetologist.
Okay.
But cosmetologist may be a dermatologist.
Okay.
What I mean to say is, every aspect, every stream, every discipline, if you look into the non-communicable point of view, non-communicable disease point of view, and giving some enhancement, aesthetic considerations, physiological in nature, you can attach this prefix cosmetic. For example, you are going to a dentist, and if the dentist is not treating for the pain, not treating the decay, but just is treating only your appearance, beauty enhancement,
Hmm.
then he can be rightfully called as cosmetic dentist. So he is a cosmetologist in his domain. Likewise, if you are going to a dermatologist and they are looking into the skin tone or appearance, as long as the skin is concerned or hair is concerned, then they are also can be called as cosmetologist. But this is wrong to suggest that all dermatologists only can be called cosmetologists. Then there is a big mistake in the understanding. Public should understand. And there is a campaign going on in the market. So we should be careful. So in one liner, if you ask me, not all cosmetologists are from dermatology background, but dermatologists can flourish, upskill in the cosmetic background.
So if somebody is getting a skin or a hair treatment through a trained doctor, right? He's not a dermatologist, but he has skills and certifications with him. So what would you call him? He's a quack or a
No.
professional?
How would you
Qualified.
call it as a quack? See, you have to understand the quack. Quack means the person who is not having medical knowledge and he is trying to treat the medical cases. Also, one person belonging to some other medical stream, for example, he may be a homeopath or Ayurvedic, and he is trying to do modern medicine practice. Then you can call quack. But any doctor, registered medical or dental doctor, because in India we call who will be called as doctor, there is a clear-cut definition, either MBBS or BDS at bachelor level. So, either medically, dentally qualified, registered doctor cannot be called as a quack at any cost. Even they are practicing some upskilled or in emerging discipline, like you rightly told about cosmetic industry. Both the people are equally having qualifications to upskill. They can learn new things, they can train in new things, they can expertise themselves. In fact, nowadays, a lot of dentists are into this beauty, cosmetics, aesthetics. So definitely a qualified doctor of any stream, if they are capable of doing you with the procedures meant for aesthetic considerations, they cannot be called as a quack. And even if somebody calling the other person quack, you should not go with it. You have to understand this. Doctors can upskill. That is their fundamental right.
Sir, when these fake academies like ILMD, they are all banned, but still they are selling their PG diplomas and running ads openly. So who all are protecting them?
See, as you rightly told, there are many institutes. They are not proper. They are not legally backing up with the proper regulatory authorities, but still they are selling, as you rightly told, PG diplomas, running the courses. So I can blame the concerned medical council or dental council. They have to be advising their members, registered practitioners, to be careful about all the banned or inappropriate institutions, but they are not doing so. And my personal opinion is, instead of doing that, what they are doing is they are going and disturbing the practitioners. For example, I am holding in my clinic the banned institutes given PG diploma. I will be rated by the regulatory authorities, not the person who is giving me the certification.
Yeah.
So that is the $1 million question here. See, in India, if you have a big industry, big setup, big finance, basically, then you are going scot-free initially. But I don't think in India it will be permanent. One day everybody will be brought to book, because somebody coming to you and asking to have this German wala certificate, Iran wala certificate, or Sweden wala certificate, you should be careful. You have to think that holding this certification, can I practice in India? Can I practice and escape the law? That you have to be equally responsible. As long as you play the victim card, then you have to complain to the regulatory authorities. If you are finding it so, you have to complain to medical council, dental council, wherever you are, you may be from Ayush council, then equally you are responsible. That is my opinion. So be careful about taking the trainings, and immediately if you have any doubt, you have to report to the authorities. Otherwise, you will be caught when you hold that certification. You cannot derive any authority through that certifications.
अभी सर एक रीसेंट केस हुआ है शिफाली जरी वाला का, जो उनका डेथ हुआ है दैट इज ड्यू टू कार्डियोवास्कुलर डिसीज आई गेस, हार्ट अटैक से जो बोला गया उसका, ये कंट्रोवर्सी है काफ़ी ये टॉपिक। तो आपको क्या लगता है, आप इस बारे में क्या कहना चाहेंगे सर कि व्हाट इज द रीजन बिहाइंड इट?
See, the reason will be revealed by detailed forensic report. As a forensic expert, what I could say is the forensic reports normally give to the public the reason whether it is foul play or natural death or unnatural death like that. But if you want to know the cause of death, mode of death, time of death, you have to get into the detailed analysis of the blood report, viscera report, and even the liver enzymes has to be, the panel should be deciphered. The test should be performed. The biochemical analysis should be done. But the news coming in from the sources, from the police, what I could guess is that despite the fasting, if you are going for a vitamin C shot, or you are going for IV glutathione injection, that will drastically lower your blood pressure, and you will not get the thrust for the heart to pump. So it will ultimately lead to sudden collapse, or you can call it syncope, you can call it cardiac arrest. Because heart attack is different, as you mentioned, both are different. Heart attack means myocardial infarction. So the blood supply for the heart to pump, ultimately the oxygen needed for the pumping of the heart is disrupted through the blockage or atherosclerosis or acute myocardial infarction. That is called heart attack. But in cardiac arrest, it is totally collapsed, jammed, you can say. It is called some hemodynamic destabilization. So that may be the reason. And again, there is underlying cause, beauty conscious, cosmetic conscious, as in forensically we used to call ABC, airway, brain, and cardiac. So here we can add one more C, cosmetic, leads to cardiac arrest.
शिफाली जरीवाला के केस में मैं आपसे क्वेश्चन करना चाहूँगी कि आजकल जो ट्रेंड है, मीडिया का ट्रेंड है, रील्स को वायरल करना, अपने आप को मतलब सबसे बेहतर दिखाना, तो उस चीज़ की ओर में लोग क्या करते हैं कि गलत डॉक्टर के पास चले जाते हैं आई गेस, मेरे अकॉर्डिंग। तो आप इस बारे में क्या कहना चाहेंगे कि हमें कैसे वाइजली यूज़ करना चाहिए, कैसे चूज़ करना चाहिए अपने डॉक्टर को? आप पब्लिक को इसके लिए क्या एडवाइस करना चाहेंगे और कैसे?
See, even I won't blame the public, because what they see, they want to practice. And what they listen, what they see, they are believing. But it is the total responsibility of the medical fraternity. They are divided. They are not auto-regulated or self-regulated. The one regulator sitting at the national headquarters in the name of Medical Council, Dental Council, Ayush Council cannot tell everything going to the public, where to go, what to take as a treatment, all this. So public is not properly informed. In the recent case, as you mentioned, there what I find is there is a medical negligence happened. The proper inquiry should be initiated. Who is the concerned doctor or family doctor, or who is treating the particular actress, and also the home remedy, home service, IV injections, medications, cosmetic treatments given at home should be booked under medical negligence, because this is a death caused by medical negligence. So in that aspect, the police, the medical fraternity should look into the case, and definitely if you are taking any beauty related treatment, if it is intravenous injection, IV infusion, even it is glutathione or vitamin C shots, you have to take under the medical supervision, particularly under the wards or operation theaters or hospital setup, not at home setup. So in this aspect, I can blame the family or victim or the concerned paramedic who have initiated this. And also vicariously, we used to call in medico-legal issues, the doctor ultimately under whose supervision, whose advice the treatment is going on, they should be held responsible for all these negligence cases.
We heard about this glutathione injection. So हर कोई बस ग्लूटाथायोन की बात कर रहा है, तो मैं आपसे ये पूछना चाहती हूँ कि इसे कौन कौन ले सकता है और अप टू विच लिमिट उन्हें लेना चाहिए? आप इस चीज़ के लिए क्या सजेस्ट करना चाहेंगे?
See, glutathione, it is available in the oral route and IV route. And oral route is safer. IV route is having all these unsafe conditions. You have to get medically fit. You have to get fitness certificate before getting that IV infusion. And I will not give the indication who to take, who not to take, because again it will be misguiding the public. But one clue I can give: IV glutathione, what purpose you are taking is not the purpose it is meant for. I hope I am not confusing. In IV glutathione, the adverse effect, the supplementary effect or side effect is the skin glow. But you are not taking it for the main effect. You are taking it for the side effect. So the main effect is not the indication in you. So it should be cautiously used with the disclaimer. And IV glutathione is not a free drug to be prescribed by everyone. It should be cautiously given unless and until the demand is there. Basically, these are all antioxidants. Our body is having antioxidants naturally. When it is getting lower, we supplement it. So regarding the drug indication, let the decision taken by your doctor, family doctor. And I am very sorry to say this, the family doctor concept now in India, globally also, slowly it is wiping out, because the specialization, super specialization, specialty, subspecialty, subspecialty, all these things actually emerging, but whether they are catering to the common public or not is still a question. So you should rely on the family doctor concept, and you have to take advice before going it for any gym wala or any beautician or any cosmetic clinics run by non-medical specialists. So you rely on the scientifically proven medicines given by the registered medical practitioner.
सर एक मेरा ये भी सवाल है कि जितने भी हमारे ट्रेन डॉक्टर्स हैं उन सबको तो आजकल इलीगल बताया जा रहा है, जबकि जो पार्लर्स हैं दे आर गिविंग इंजेक्टेबल्स बट स्टिल दे आर लीगल. सो हाउ कम?
I think you should be more clear about this question. I will clarify. Why you are asking, I could guess. Recently, the qualified doctors, particularly the dentists, they qualify in dental surgery and they have upskilled, they have learned, they have trained themselves in cosmetic procedures, and they are being termed as quacks or illegal, as you rightly told. But in beauty parlors, in the gym, they are giving the similar things, they are unquestioned. This is what you are. So, if you understand the conspiracy, there is a competition between dermats, not all dermats, a particular group of dermatologists who are all interested to set their career in beauty, cosmetics, not in the pathology, dermatological lesions, skin lesions, hair-related lesions and all. So, that group, what they want to do is they want to vacate the dentist turned cosmetologist from the market. Why they are doing so? Because the number game, the dentists are 3 lakh plus, around 3,50,000 dentists in the country. And they are also getting saturated. And they are also into the various training programs, authorized, unauthorized. They get into the cosmetic industry. So when they are getting into the industry, because of their inherent hand skills, they are possessing skills, because they are already into the surgical skills, and they do consider the aesthetic considerations also, because face, their area belonging to the 2/3 of the face, they are into cosmetic considerations. So they are getting powerful, skillful, and more financially they are getting sound. So the other group who is willing to compete them, willing to penetrate the market, they don't want to blame the saloon and other people, because through that sources they may get the patients. Because ultimately the saloon people, the cosmetic chain, they cannot get into too much into the procedures. They can do basic works. So this particular ambitious dermatology group willing to attach with them, so they will not blame them naturally. This is the game. This is the conspiracy. So the competition between dermats versus dentists, obviously those who are all willing to be in cosmetic industry, they want to, fight each other, or the regulatory authority also. For example, in Telangana, The Telangana Medical Council openly supports this dermat group.
Okay.
And they are openly opposing the dentist turned cosmetologist. So in this game, the salon and beauty chains, they are supporting the conspiracy indirectly. They are not willingly, but they are being utilized by the dermat group. That is why there is no raid.
सर जो ये तेलंगाना काउंसिल है जो ये उस ग्रुप को सपोर्ट कर रही है, तो ऐसी क्या लीगैलिटीज है उनके पास जो कि वो उनको सपोर्ट कर रही है इस तरीके से?
See, that is not a group. That is also a association, by the way. But it is not a statutory body. It is not a, it doesn't have any regulatory authority, by the way. But they got that influence to influence the state medical council. And I hope that particular group, not everyone is supporting this venture of vacating the counterpart. Only a particular handful of members, they use the tag, the tag called the association name, the IADBL, Indian Association of Dermatologists, Venereologists and Leprologists. You see the name only not having anything called cosmetics or aesthetics or trichology, but still, if you ask them, they will call me also a quack if you ask them, because they want to find the shortcut to capture the market. So that group having one illegal force, I could say, called ITAQ. That is ITAQ. That is IADBL Anti-Quackery Cell something.
Okay.
ITAQ. So this is illegal because it's not established by government. So they can petition, they can write about you to the district collector and invoke anti-quackery law and misguide the regulatory authority, the state medical councils through their inner people, and they are doing this. The raids and further FIRs and publicly naming the practitioners as quacks and all.
सर एज यू सेड कि गवर्नमेंट ने इनको बनाया ही नहीं है, तो देन उनके पास वो लीगैलिटीज आई कहाँ से कि वो उनको ब्लॉक कर सके?
There is no legality. That is what I am saying. They are pretending to be legal, and the people who are all seeing them and admitting their legality, they should be explained that this is not legal. And how they are operating is they go to the government, district magistrate or district collector, and tell about the quackery. Generally quackery should be eliminated. Without a medical degree or dental degree, somebody doing practice, that should be eliminated. But these people go and brief the district administration and ask them to form the committee or misguide them and get some orders. And with that orders, they reach the famous practitioners in the cosmetic industry of non-dermatological in origin. They go and blame and they frame and file FIR, and this is what happening.
ये जो IADBL एसोसिएशन है, ये कौन से सेक्शन में बना था और इसकी क्या लीगैलिटीज हैं?
Normally, these kind of associations are made under either Indian Society Act 1860 or the Companies Act. But I hope this is under 1860 Society Act. So while forming this society, they might have given the memorandum of association, bylaws, aims, objective and all. I'm sure that it is not having cosmetic or aesthetic in consideration. But tomorrow or day after tomorrow, they can go and amend it. So it is basically an association. It's not having any regulatory power. Because of their number, maybe money and muscle power, they may be getting into a pressure group kind of thing. Otherwise, they are one among the lakhs of associations, rather thousands of associations in the country.
सर इफ आई एम नॉट रॉन्ग, दिस 1868 एक्ट ये वही है ना जिसमें RWA भी है?
Yeah, not 1868, it is Society Act 1860.
अच्छा, 1860.
Yes, RWA, Residents Welfare Association, or any, for that matter, any association, you can formulate. Even if you have 7 members, you pick up from 7 different states, tomorrow you can form an association. Because we have basically right to form an association is our fundamental basic right. So, right to form association, you can form an association. It's not a big deal.
So sir, उनके पास तो इतना राइट नहीं होना चाहिए कि वो दूसरे प्रोफेशनल्स को जाके टारगेट करें?
No right. Who told they have right? Only the people, once they come to know about the legality, they will understand there is no right for them. Only thing is, in the name of public safety, they do all these campaigns, paid news, they appear in the social media, they hire people,
Hmm.
they hire the media, the press, and propagate the idea in the name of public safety. And one thing I don't like about the propaganda is they are saying that the qualified dentists are quacks. And they are saying about there are a lot of drugs to be administered. There is a lot of knowledge of the pharmacology, which medicine to be prescribed, so usage of steroids and other medicines and other lesions. Sorry to say this, these are all being read by all any MBBS or even BDS or even paramedic allied health people. They are also reading the pharmacology in their syllabus. So it's very weak argument that only we the people belonging to the dermat community will know about the drugs. We will know about all the skills which is necessarily needed in the cosmetic industry. Without any proper training, immediately after the MD dermatology, I possess every skill needed for cosmetic industry is totally an illusion.
सर जो भी इंजेक्टेबल्स हम लेते हैं हेड एंड नेक में, तो हु इज़ द बेस्ट प्रोफेशनल्स टू गो विद? वो एक डर्माटोलॉजिस्ट होना चाहिए, कॉस्मेटोलॉजिस्ट होना चाहिए, ऑप्थेल्मोलॉजिस्ट होना चाहिए, या कौन होना चाहिए? बेस्ट प्रोफेशनल कौन रहेगा? हमें किसके पास जाना चाहिए फॉर इंजेक्टेबल्स?
I want to be a little bit neutral here. Nobody is directly qualified to give injections for the beauty or aesthetic considerations. If you compare the dentists, ENT surgeons, ophthalmic surgeons, and dermatologists, I will give least mark to dermatologists.
Okay.
Because they know about the skin diseases, skin lesions, the anatomy of skin. But as long as injection is concerned, I will give the opposite. I will support the dentists in the first number, provided not all BDS or all MDS are directly into this. They have to undergo specified training. Now you can ask me, if you give 1 year of fellowship training to all the specialists, counterparts in head and neck region, you give 1 year training for ENT, 1 year training for opthal, 1 year training for dermatologist, 1 year training for dentist. Still I am saying the dentists who got 1 year upskilling training will be the best for your head and neck region, Botox, fillers, lasers, all these things. The reason being, if you compare MBBS and BDS, MBBS more of theoretical, still till they become house surgeons. So in first year they both study anatomy, physiology, biochemistry, pathology, then microbiology, pharmacology, medicine, surgery. Then in final year only BDS people are into dental only, and in second year onwards, even the first year onwards, they get into the hand skills. If you ask any BDS graduate, in first year, what you do, they will say they make cubes. They start with making cubes. So their fingers, their hand skills are enhanced from the 18 years. Can you imagine? Any medical professional, dental professional, they get into that after NEET exam, +2, they get into the 18 years of age. From 18 years, you are learning some sculptural work, some hand skill work, and from second year you get into the preclinical hand skills. Then third year you are doing patients. If you ask any BDS people, they will tell you from third year onwards in the college itself they are allowed to do clinical treatments operating on the face. Now you tell me, dermatologists, when they start operating on face? Never. They may examine, they may identify the disease, they may diagnose, they may give the medicine, medically they manage, and after their completion of MD only they do some operations, some hand skill related works on the face. So I think I have satisfied the question, who is having more
best
skill.
Professionals, right?
And in MBBS also, they are nothing to do inject on the face as such. They are generally Bachelor of Medicine, Bachelor of Surgeon. And ENT also, they are into more of disease point of view, pathological point of view. Same condition for ophthalmologist. But here the beauty is the dentist from day one, their consideration is cosmetics and aesthetics. So not all specialists without proper upskilling is fit enough to do this industry. But after training, naturally the dentists are getting more skill. That is why they are being targeted.
सर ये जो इंजेक्टेबल्स लोग लेते हैं लाइक सेलिब्रिटीज़, बहुत सारे सेलिब्रिटीज़ लोग लेते ही हैं, तो क्या ये रिवर्सिबल है? अगर मान लीजिए किसी ने अपने लिप्स का सर्जरी कराया या नोज़ का कराया, उसको लॉन्ग कराया, तो ये रिवर्सिबल है कि उसको वो फिर से चेंज कर सके? या
Actually, reversible the sense if you are mentioning cosmetic surgery, again you have to redo the surgery. Surgical correction cannot be correcting automatically. But as you said, injectables can be reversible with time. The fillers and Botox may come out of, you can come out of that. So if you understand the biochemistry, the how the drug is operating, the botulinum toxin, it is basically a toxin. Again, it is the side effect becoming the main effect in the cosmetic considerations. So it basically relaxes the muscle. So once the drug efficiency is going up 3 to 4 months or even after 6 months, again the condition will be back. But till the time the consumer, the patient may not be patient.
Okay.
So they may go for consumer forum, they may go for civil case, compensation. And if a certification is not perfect, you have German wala, Sweden wala, all these fake mentors institute issued certification, then they may go for the regulatory authorities like medical council or state dental council or medical council, and again they can sue you. So better you before taking any treatment, you analyze the doctor and his or her certifications.
सर किसी का भी हम सर्टिफिकेट कैसे चेक कर सकते हैं? क्या हम डायरेक्टली डॉक्टर से पूछ सकते हैं कि यू आर सर्टिफाइड और नॉट, या इसके लिए कोई वेबसाइट है जहाँ से हम चेक कर सकते हैं कि ही इज द
Yeah, many
right
people
person?
are asking me the question, how can I identify the right cosmetologist through their certification? Even if they possess some certification, whether that is right or wrong, where to check? I can tell you, to be frank, you have to consult a lawyer, but every patient cannot be consulting the lawyer,
Right.
because lawyers, again, they have to consult with medico-legal lawyer again. So in India, medico-legal science is very, it's not proper in shape, because if you ask the lawyer to understand the medical things, it is very difficult, because lawyers are from basically arts and commerce background. So the solution, I can give you a temporary solution. You just come to the medico-legal forum, or you can check with the council, concerned council for cosmetology, Coctracy, Council of Cosmetology, Trichology, Regenerative Aesthetic Science of India, and you mention the doctor, which area. They may help you checking their credibility, qualification, and they can, as a council, as a responsible natural stakeholder of the industry, even the Coctracy, the council, and the medico legal forum is equally responsible, just like a statutory body. It is not a statutory body, it's a voluntary self-regulatory council. Just like in advertising industry, we have Advertising Standard Council of India, ASCI, like that they have their self-regulation, but they will help you. If you go to their website, email them, they will help you. So before taking treatment, I think one should
go.
get this idea. If you could not get any idea, you can come to the council or medical legal forum to comment on the particular cosmetologist or dermatologist, whether they are fit enough to give this procedure or not. Don't blindly go with he or she is a MD dermatologist, so they will be well versed with these qualifications. Because I have talked with a lot of senior dermatologists. They are shocking to know the version that dermatologists are de facto cosmetologists. This is being built. The illusion is created by the politically motivated, financially motivated certain group of people.
सर ये सेल्फ रेगुलेटरी मतलब क्या है? What is the meaning of self regulatory?
See, if you look into the regulation of the councils or forums or these associations, the bodies basically, I can give you under 3 headings. One is constitutional body. Means the Constitution of India itself giving a note, this body should be formed in this way. For example, Finance Commission of India, Election Commission of India, UPSC, all these bodies are constitutional bodies. Means it has been mandated by the Constitution itself. And next comes the statutory bodies like Medical Council, Dental Council. They are being formulated through an Act of Parliament, like Dentist Act 1948 created Dental Council of India Act. So like that Bar Council of Act, so it created Bar Council. These are all statutory bodies. And for cosmetics, beauty, aesthetics, regenerative science, all these, it's emerging discipline, by the way. So it is not covered under the statutory body. Think about 1948 Dentist Act has been enacted. In 1951 Medical Council Act enacted. So by the time these fields are not existing, These are all emerging disciplines. So no other way, only the voluntary self-regulatory councils can only regulate it, because don't expect everything can be regulated by the government or statutory body only. Because in voluntary self-regulatory setup, the practitioners club together, they form the board, the committee, and they look into the pros, cons, and give the protocol. They give the protocol. That will be ideal, no doubt. Because the like-minded practitioners, they know what is the trend, what is the problem, and they are all qualified only. It is not like unqualified people. They are qualified, they have the basic right to practice. Because these voluntary self-regulatory council don't give you any license to practice. It is other way around. The licensed practitioners join together in the voluntary self-regulatory platforms and they decide the future. Means a set of senior people setting the trend for the junior people. So these voluntary self-regulatory organizations, they are not court. They are not adjudicating agencies. They are not arbitrary agencies. They are not deciding the case. You can get their help for decide which doctor, whether their certification is genuine, whether if I am taking treatment, it will be a right thing or wrong thing. These kind of advices you can get. And for taking action, you have to approach the consumer forum or the police.
Okay.
Because when the criminal case is to be registered, you have to file an FIR. So you go to the police station. If they don't listen, you go to the district magistrate and ask the district magistrate, the district court or sessions court to give order to pass the order, necessary orders to the police to file an FIR. If it is a criminal, if you want to approach the matter criminally, you have to do this. If you want to approach the matter civil, as a civil matter, as a compensation, you can go to the district consumer forum. There, if you lose, you can go to state consumer forum. Then there also, if you lose, you can go to national consumer forum. So better you fight for your rights. Better prevention is better than cure. So you prevent taking treatment from the wrong cosmetologist or wrong surgeon or a doctor. So better you consult these voluntary self-regulatory councils. That is the best way, if you ask me.
सर ये जो इंजेक्टेबल्स होते हैं दे आर इन लिक्विड फॉर्म राइट. सो जब ये दिए जाते हैं तो इनसे हमारे माइंड पर या हार्मोनल चेंजेस ऐसा कुछ इससे इफेक्ट हो सकता है हमारी बॉडी पे?
See, if you ask me the adverse effect, the fillers are, if your injection is wrong, if it goes wrong, it may go up to the blindness also. So it is better if I tell all this, then the public will be scared. Nothing to worry about. See, once if you decided you want to look beautiful or cosmetically enhanced, then you should not look into the adverse effect. But under proper hands, nothing wrong. You go. That's why I'm saying you identify the person who is going to give you fillers or Botox. So accordingly, your fate will be.
If any professional who have a fellowship with this Cosmetology council, so if any mishappening happens there, so whom we should consult?
See, if you are going with a concerned cosmetologist, having their basic license to practice, either MBBS or BDS or any other masters, basically they have the license to practice, then they have fellowship from Cosmetology.
Okay.
So you can complain with Cosmetology directly, and the Cosmetology, the self-regulatory council, will take action up to remove them from as a fellow or member, and they will give you advice whether you can go to the consumer forum is a right case or not. And it is again consultative in nature, advisory in nature. You can directly also go to consumer forum. There is no blockage for you. But normally when you go with the consent of the council, you will get the right or wrong, because sometimes you may be misguided by the competitor. For example, think about the situation. You have taken treatment from a non-dermatologist having Cosmetology fellowship. They are fellow of Cosmetology or they are member of Cosmetology, the council. And again, you cross-consult with a dermatologist. They may say you that you have taken treatment from the wrong person, because you have to understand there is a clash between dermatologists versus non-dermatologists. So by the time if you come back to the council, Cosmetology, you will get the reality, you will get the truth, because there may be a chance that you may be misguided, you will land up in a consumer case, you will lose your peace of mind, you will lose your money, and you have to pay to the lawyers also, hearing by hearing. And at the end of the day, you are fighting for, if it is for a temporary nature. For example, if you leave for 3-4 months, you will be perfectly all right. You will be okay. But for that, if you file a case, you have to go for the court for 3-4 years. So better avoid litigations. So you come to the council. The council will definitely take the neutral viewpoint. They will not blindly support all its members or fellows. They will look into the protocol. Even the council may look into whether you are charged within the limit or you are overcharged. So all this facility, because of its voluntary self-regulatory nature, it is openly available to the public. But in case of conventional treatments, any procedures, medical council or dental council or Ayush council and all, they will not get into this much of personal touch because they are all statutory bodies. So you have to follow the route of consumer forum, you have to waste your time, money, energy, then only you will get the justice. But this is beneficial.
सर तेलंगाना में ये इशू बहुत ज़्यादा हाईलाइट हो रहा है कि जो ये मेडिकल काउंसिल है और एक डेंटल काउंसिल है, ये दोनों नोटिफिकेशंस दे रहे हैं, तो उस चीज़ पे आप क्या बोलना चाहेंगे?
क्या no, you want to say why they are giving contradictory
statement they are giving?
Yes, it's right. I have to be say this openly. I am shameful of this attitude of both state medical and state dental councils. Rather, they should be shameful because being a constitutional Indian, I have to highlight this constitutional crisis, I could say, because whether you are a medical council or dental council, you have been established by an act of parliament and you have to follow your state dental council, state medical council laws respectfully passed by the state assemblies. In Telangana, it has been passed by Telangana Assembly. So, being a statutory body, you have to respect the statute. And if you read the notification released by Telangana State Medical Council, it has given certain observations that even maxillofacial surgeons coming under Dental Council of India, they are not eligible to practice aesthetic practice or cosmetic practice or hair transplant. And for that, they are taking the support of an RTI reply taken from National Medical Commission. My question is, you the state body, why don't you have regular communication, formal communication through proper channel, through the hierarchy with the National Medical Commission? Why you are using the route of RTI? RTI is for the common public. When they could not get the reply, this is the gift given to common public and the right to seek information enshrined in our constitution. In 2005, it has been the act passed for right to seek information, right to information act. Why do you be the part and parcel of this regulatory framework, National Medical Commission? Why don't you directly write or directly approach them at your own channel and get the reply? Why you are using RTI? This itself, first of all, I blame. The approach is not right. Secondly, even if the State Medical Council releasing such notifications, challenging the counterpart, that is State Dental Council, again it is a constitutionally wrong. It's totally illegal. And I will not give clean sheet to the State Dental Council. Once if your counterpart releasing such notification, again you are releasing a counter notification, and in one point of time, I could say both are wrong. So, the judiciary should intervene. When there is a regulatory overreach, the judiciary should intervene because public are confused. Why not? Because doctors are confused, dentists are confused, dermatologists are confused because of this. And only thing is, the paid news is going good. Next day, the newspapers publish both the things. First day they publish dentists are banned. Next day they publish no, dentists are not banned, challenged by State Dental Council. So, I think the CM of Telangana should notice this contradiction. Ultimately, this will not give good impression for a governance, for good governance under Indian Constitution. So, the CM Telangana should look into the matter. The CMO should look into the matter, and they have to warn both the statutory bodies, state level statutory bodies, to stay within the limits. Otherwise, we can get orders from the judiciary, either under Article 226 or under Article 32. If any individual citizens, be a dentist or dermat or cosmetic practitioner, their right to practice is questioned, they can directly approach the High Court or Supreme Court. So by the time all these unconstitutional affairs will come to the limelight.
सर इस टॉपिक पे जो गर्मा गर्मी है ये सिर्फ तेलंगाना तक ही सीमित है या फिर अदर स्टेट्स भी अफेक्ट हो रही हैं इससे?
See, I don't want to compare, but for the sake of understanding, I am saying any kind of mutiny, revolt will have a center point. If you see 1857 Indian War of First Independence or Sepoy Mutiny during British period, the mutiny, the rebellion attitude will be from a source. So the source is Telangana, as you write, and I can identify who is doing it, which particular closed group is doing it, but I don't want to give publicity by naming them. And they create this nuisance, and it is slowly spreading. And earlier also, there was an FIR filed in Telangana against some non-dermat cosmetologists, and through that matter, immediately, this is just like a communicable disease. Karnataka State Dental Council also released some notification. Then Maharashtra, then Kerala. So this is the second outbreak, like COVID outbreak. I could see the outbreak by face. Before some 2-3 years back, it was there in Tamil Nadu also. In Coimbatore, they have such notices released to non-dermat. Then Kerala. So right now it is the cyclone is now the center point is with the Telangana. And definitely it may directly come to nearby states, or even it can come to national capital region also, because there was one newspaper cutting I could notice that if any non-dermats doing cosmetic practice, they diplomatically give this news, like if you are not sticking to your own domain, ultimately the inference is this only, cosmetic practice only. They are saying 3 years jail and 20,000 fine. It was published in Delhi Medical Council, published by Delhi Medical Council in the newspapers. So regardless of the state, it is spreading. This rumor is spreading very widely.
सर आपको क्या लगता है ये जो एस्थेटिक इंडस्ट्री है जो इतना बूम कर रही है, इतना बूम पर है, तो इसका क्या रीजन है? मतलब इन्फीरियरिटी कॉम्प्लेक्स की वजह से ऐसा है या सम अदर रीजन इज बिहाइंड?
There are multiple reasons, because it's nature to believe, nature to accept that everyone is willing to appear in better way. Yeah. So it's a old concept only. Right now we have new inventions, materials, machineries are imported to our Mother India. So naturally people are getting into it, and medical fraternity, when they are getting into the cosmetic and the aesthetic industry, definitely it will further boom. And that is why the conspiracy is going on, that it's not open to all, one group of people dominating the industry, and it is not healthy also.
सर ये जो फाइट है ये सिर्फ इंडिया में ही चल रही है या वर्ल्ड वाइड है?
This hardcore controversy of blaming each other quack is happening nowhere in the world. In India only it's happening. Okay. And why it is happening? Because we Indians are more into government centric. So government is not clarifying, means there will be a confusion.
सर ये जो फुल बॉडी एस्थेटिक होता है जिसमें हम टमी टक, आर्म टक, ये सारे प्रोसीजर्स गोन थ्रू करते हैं, तो क्या ये हार्मफुल होता है? क्योंकि हम लोग रेडिएशंस ले रहे हैं, तो रेडिएशंस ऑब्वियसली सब
regarding the harmfulness, if you ask me, every medicine you are taking, even it is a paracetamol, it has its own adverse effect. Right. A single paracetamol injection can harm the liver permanently also, kidney also. So that is not the case, but it is a judicious approach through under qualified hand. When you take this modern medical intervention, it is a gift to the humanity. So nothing to blame or nothing to worry about taking any kind of treatments within the pharmaceutical margin, and within that frame you can take nothing wrong in it, because sometimes your weight loss, your metabolic balance is connected to your metabolic syndrome. Metabolic syndrome in the sense, it may be connected to your cardiovascular system, it may be connected to your liver, your gut, or it may be connected to the malignancy, the cancer, and hormonal. So it's not about just weight loss. It is physiologically making you fit, free from getting metabolic disorders in future. You can avoid heart attack also. You can avoid cholesterol, high cholesterol also, hyperlipidemia. You can avoid malignancy also. So not only in the appearance point of view or beauty point of view, these things are being carried over by today's consumers, patients, and the doctors and surgeons. But also there is a very important element, the disease point of view. We call it as non-communicable diseases, because bacteria, virus, and all, through that, when you get diseases, it is communicable diseases.
Communicable, right.
But here we name it non-communicable diseases, basically metabolic related diseases. So for that, weight reduction is the key.
एस्थेटिक इंडस्ट्री में डॉक्टर्स के पास कौन से वैलिड सर्टिफिकेट्स है जो हमें चेक करने चाहिए बिफोर गोइंग टू देम?
So as a patient, if you go to the doctor who is claiming to be a cosmetologist, if he is having PG diploma or a diploma, vocational, skill related, Skill India, international, educational board and all, you immediately run out of the clinic and come out of the clinic, because in cosmetic industry, no doctor will accept international, foreign university, or Skill India, vocational training, Germany, Sweden, Iran, Iraq, all these certifications. You have to check which council rather than which council, which fellowship they have taken, because only doctors can get upskilling through fellowship. Fellowship is the best way and only legal way to upskill, to learn more. There is no PG diploma. For that, you have to rely on a university. And university cannot touch up the medical matter.
Right.
Because university coming under UGC, that is for your physics, chemistry, botany, zoology, all these arts and science. And for technology thing, AICT is there. For BE, BTech. For medical, there is a medical council, dental council, pharmacy council, nursing council. So the certification, only you go with bona fide upskilling is done or not. Instead of telling to the patient, what I prefer is, what you avoid, I can tell. You avoid all this. Any institute claiming international, global, all India, these are all prohibited, because there is no such existence of this institute or academy or mentor. And second thing, you have to check the association, in which association the particular cosmetic practitioner is affiliated to. And you check the name. The association should carry the name of cosmetology, trichology, regenerative, aesthetic science. Again, it should be registered with government of India. Then only you will get the complete monitoring. And also third thing, you have to check what is the affiliation of the person, whether he is having proper legal consultancy or not. So there is a medical legal forum. If he is belonging to that forum, you can believe the particular practitioner will go with at least basic law, because doctors are not sound in legal things. So that is why I suggest both the patient and the practitioner go with these three things. I call it as triple layer protection: one council, one association, one forum. If you name, I can name Coctracy, the Council of Cosmetology, Trichology, Regenerative Aesthetic Science of India, and D Fascia if you are from dental background, and AAPPCT if you are from Ayush background, and the association is Dentofacial Aestheticians, Cosmetology, Trichology and the Association. And if you are from Ayush background, Ayush, Association of Ayush and Physiotherapists Practicing Cosmetology and Trichology. Then third one is forum, that is medical legal forum, because it sets guidelines, how to print your letterhead, visiting card, signboard, prescription pad, how to get the consent form. Because today patient may agree for one treatment, tomorrow they may deny. They may say that I didn't want that. You give the money back. So the doctor is, if they are not having consent form, they are stuck. So consent form also very important. And these are all things not given by the council or association. So you need a forum, medical legal forum. So these three things, you have it in your mind, the triple layer protection. Then fourth one is whether the particular practitioner, particular cosmetologist coming under some corporate shield or not. They have the brand or not. Because individually, one individual person you cannot trust. So even if you trust, the damage also will be more. You can directly go and sue the particular person. So better have a corporate. So tomorrow if you ask a compensation also, individual person may not give the compensation. So go for a corporate setup. So I advise both patients and practitioners always get registered your firm, your clinic under a corporate shield. So triple layer protection with corporate shield. I call it TLPCS scheme. So in this scheme, the cosmetic industry will be very beautiful and cosmetic.
जैसे सर अभी आपने सर्टिफिकेशंस की बात की, तो कुछ लोग होते हैं जो कि अब्रॉड से करके आते हैं सर्टिफिकेशन वाला, तो उस चीज़ों में हमें क्या चीज़ चेक करने की नीड होगी?
See, when they are doing abroad their bachelors, they should be called as FMG, foreign medical graduates. There is a system in our Indian medical system. They have to write exam and clear it and pass the examination. So after passing, again they go to abroad for only for cosmetic. Then you should be suspecting them why they are not into our India, because foreign cosmetic law is different.
अच्छा.
There the cosmetic law is more stringent in the sense there is more strong consumer law. But in India, I don't think doctors. I could not see so much of punishment awarded against the doctors. So you cannot bring that system to our India. So better their basic license to practice, let it be India or foreign. But once they got Indian license to practice, then you look into Indian upskilling in the cosmetic. That will be safer for both the parties.
सर बहुत सारे प्रोफेशनल्स हैं जिनके क्लिनिक में मैंने देखा है कि उनके पास जर्मन एंड स्वीडन के सर्टिफिकेट्स होते हैं, तो इन दोनों ही चीज़ों में हमें मतलब उन्होंने जो यहाँ से इंडिया से लिया हुआ है सर्टिफिकेट, यहाँ के इंस्टीट्यूशन से कह लीजिए किसी से, या वहाँ के जो मेंटर्स आए हुए हैं उन्होंने उसको वो सर्टिफिकेट्स प्रोवाइड किया है, तो दोनों ही पॉइंट ऑफ व्यू से बताइए कि पेशेंट के लिए और डॉक्टर्स के लिए क्या वैलिडिटी होनी चाहिए इन दोनों में?
So you should be very careful about the claims. If I am claiming I am from Germany, Germany certified. So somewhere I am not telling the truth, either whether I went to Germany or I sitting here I got that. Because in India, Indian law prevails. Germany law cannot be prevailing. Yeah. And if you are holding a German certification, you go and treat the Germany citizen.
Exactly, right.
And having Germany certification, if you are treating Indian citizen, that means when India part of Germany. So all these questions will arise. So better you avoid these certifications as a doctor, as a practitioner, and also as a patient also, you don't give any weightage to this foreign derived certifications, because it is nowhere going to help. And one thing, it can be helpful to the patient. They can sue the doctor, saying that they hold a fake certification, impersonation, fraud, cheating, whatever case. You can go and file an FIR also. You will be winning, because ultimately this is unethical. If you go and read the basic ethics, the Medical Council Act, holding these kind of qualifications, questionable qualifications, pretending to be someone else, or impersonation, all these coming under crime. So better avoid.
जो भी कॉस्मो लीगल जितने भी एस्पेक्ट्स थे, आपने वो सभी डाउट्स हमारे क्लियर किए हैं, इवन हमारी ऑडियंस के भी. तो मेरा लास्ट बट नॉट द लीस्ट एक और क्वेश्चन है आपसे. कोई आपसे डायरेक्टली कनेक्ट करना चाहता है, इफ़ दे हैव एनी क्वेरीज, क्योंकि देखिए सेलिब्रिटीज़ लोगों का तो सब कुछ आउट हो जाता है थ्रू न्यूज़, बट जो आम जनता है, जो कॉमन पीपल है, उन लोगों का प्रॉब्लम ऐसे सामने नहीं आ पाता है, तो वो आपसे कैसे कनेक्ट करें?
So connect, you have your telephonic or email, you can get that numbers and connect. You are welcome.
So guys, for any Cosmo legal queries or any doubts, you can directly contact Dr. VK Swami sir. एंड जितनी भी डिटेल्स हैं आप सब देख सकते हैं, हमारे स्क्रीन पर है. आप कांटेक्ट कर सकते हैं थ्रू डायरेक्टली कॉल, व्हाट्सएप और ईमेल आईडी. और अगर अभी भी आपको इस पॉडकास्ट से रिलेटेड इसमें आपको लगता है कि कुछ क्वेरीज सॉल्व नहीं हुई है, तो आप लोग उसको कमेंट्स कर सकते हैं. तो हमारी जो लीगल टीम है, बैकएंड टीम है, दे विल कनेक्ट यू डायरेक्टली एंड विल सॉल्व ऑल योर क्वेश्चंस. ऐसे और इंटरेस्टिंग टॉपिक्स के साथ हम वीके सर से दोबारा मिलेंगे हमारे नेक्स्ट पॉडकास्ट में. दिस इज़ मी, एंकर जानवी वर्मा. मिलते हैं अगले पॉडकास्ट में. थैंक यू सो मच गाइज.